Thank you. Thanks. I can see some persons are already making good use of the chat. Once again, while we wait for a few more persons to join, please introduce yourselves in the chat and which country and organization you're from. My name is Wayne Kotie, and I'm the Clean Air Program Manager for GAIA and BFFP Africa. And that's the Global Alliance for Incinerator Alternatives and Break Free from Plastic movement in Africa. Next slide, please. Next slide. Please take note that you can also listen to today's webinar in French and Spanish by choosing from the interpretation options at the bottom of your screen. Yeah, thanks. Next slide, please. And let's go through a few housekeeping rules that matters, at least within this space. And please make sure that your full name and organization are displayed. Your name and your organization are displayed on the Zoom account during the event, and keep your microphone muted. And you may use the Q&A function on the Zoom, commonly found at the bottom of the screen or where your Zoom controls are. Sometimes maybe someone is presenting and you have a question. Just before you forget, you could just make sure you use the Q&A session. And these questions will be answered by the speakers during the allocated time for question and answer. We also invite you to use the chat box to introduce yourself and exchange contact information or links with your fellow participants. You never know, we could all network here as well. This event will be recorded and shared afterwards, just for you to note. And if you have any technical issues, please reach out to any of the GAIA staff via the chat box. I know Claire is available on tech support. And thank you very much. Yeah, so we have a packed up agenda today. I would like, we'll be premiering a documentary. We'll show the trailer today. We're also, there will be a presentation of key findings of our AQM reports in Nigeria, Indonesia, and the Philippines. And then we have a Q&A session. We'll also have panel discussion where our member organization in Nigeria, Green Knowledge Foundation, will be speaking on the role of grassroots movements in citizen science advocacy efforts. And we'll also have presentation on air quality governance. And then we'll have a Q&A session, and we'll round it up from there. And thank you very, very much once again. And we'll be proceeding directly, like I said, to the Q&A session. And then we just move straight on to our AQM documentary trailer. Please go ahead. Thank you.
Especially kung may mga kalamidad, ang mga basura na to diri karon sa Kandaway, it will come back to us people here in Dumaguete.
Mana terus biasanya dilempar kemana?
Kalau sampahnya ya pastinya dari kayak TP, terus.
See the smoke. You cannot even see back. See it oh. This is what we are facing. See us. May God help us there.
Around the world, communities have long suffered from the burden of waste incinerators placed in their backyards. But in 2024 and 2025, residents in the Philippines, Indonesia, and Nigeria did something powerful. They gathered the data to tell their story. This is Clearing the Air, the truth behind waste incineration.
Thank you very much, Claire. We have a lineup of expert speakers, including local members, researchers, and partners who will be who will share their insights and experiences on the power of community-driven air quality monitoring. Our first speaker is Dr. Oladimeji Babatunde, and is currently the head of Department of Physics at the College of Basics and Applied Sciences, Mountaintop University. He aims to teach complex physics concepts in simple ways that relate to everyday human experiences beyond just having equations. Welcome, Dr. Dimeji, and you have the room for 15 minutes. Thank you.
Okay. Thank you, everyone. Good day. It's an afternoon in Nigeria, so good afternoon from Nigeria. It's a very exciting moment for us in Nigeria when we got on board this project, and we will be eternally grateful for this opportunity to tell our story with empirical data. Despite the limitation of our measurement, which we are going to highlight, it is important to know that data drives advocacy. And over the years, this community in Onodjohwo had been polluted and obviously just left to reporting by observation. But this time around, 2024, 2025, this opportunity came to have data, back up our observation, and to drive our advocacy. And that's why I titled my slide, Air Quality Monitoring in Onodjohwo, Nigeria, Key Findings and What They Mean for Onodjohwo. Next slide, please. Now, traditionally, measuring particulate matter is quite a deal. It's expensive because to have reference grade sensors, especially for low and middle income nations, part of which Nigeria is essentially difficult. Some of them are between $25,000 up to as high as $50,000. And this had placed a critical limitation on how much data science-driven advocacy we can do. But internally, we're also grateful for the advances in low-cost sensor technology, which brought a device like HearBeam-3, a portable particulate matter monitoring device, rechargeable, to stay for about 15 hours, and then was easily deployed and had met US EPA stringent PM standard rules. So this aided the deployment, of such a high-quality sensor to measure particulate matter in a place like Onodjohwo, Nigeria. Next slide, please. And there are major sources of particulate matter pollution, among which I highlighted a few, a bit exhaustive anyway: waste burning and combustion plants, pyrolysis machines, incinerators, waste gasifiers, waste to energy plants. Others are coal-fire plant, fuel plant, construction, excavation, quarrying, open burning of domestic and agricultural waste. All of these are as important sources of particulate matter, releasing various other cocktails of pollutants, ranging from elemental to particulate to gaseous. And then we have some dioxins and furans, all coming out of all of these pollution sources. Next slide, please. Now, coming to Onodjohwo, Nigeria, which is located in one of the 36 states of Nigeria, Ogun State specifically, borders the popular Lagos State, which Onodjohwo has become radically and rapidly industrialized in the last 10 years due to its proximity to Lagos State. It hosts diverse kind of industries, ranging from plastic recycling to steel burning to chemical processing, waste management facilities, which included a tire burning plant that is central to this study. And this plant is located on the coordinates that is shown, 6 degrees north, 3 degrees east, and it's located in this highly industrialized zone near a junction that is called Kamalu Junction. And if you check the Google Earth map, you are going to see we try to map different areas around this facility. Other facilities are captured, about 7 other facilities are captured in my area map, and we had where we place our sensors and measurements as we go on. So this is a typical representation of the industrial corridor in Onodjohwo, Nigeria. Next slide, please. Now, particulate matter comparison. If you pick the human hair, which is estimated to range between 550 to 70 micrograms per meter cube, essentially, we are going to see how tiny and small-sized particulate matter 1, particulate matter 2.5, and particulate matter 10 are in direct comparison to the human hair. Pick a strand of the human hair, and then you are talking about a microfraction of the human hair. That is how small, how minute these particulate matters are, and they can be suspended in here for hours to week. They can be transported over several kilometers due to various factors in the atmosphere. Can we go on to the next slide, please? The health effect of particulate matter has been documented. Particulate matter 10 is associated with coughing, breathing difficulty, decrease of lung function, chronic bronchitis, worsening of asthma, premature death of people with heart and lung diseases, also premature death, cardiovascular diseases, and all sort of ischemic heart disease, lung cancer have been associated with elevated level of PM 2.5 in the atmosphere. Next slide, please. Now, we adopted similar methodologies for our measurements across the 3 countries, that is between Philippines, Nigeria, and Indonesia. But there are specificity to how we're able to set up for different reasons. In Nigeria, we engaged 4 community volunteers in Onodjohwo, and out of these 4 community volunteers, we used 3 of them for our mobile monitoring, which was conducted between 1st of October and 29th of October, excluding Sundays. That brought us to having 25 days each of mobile monitoring from 8 a.m. to about 6 p.m. on daily basis, except Sundays. And what these mobile volunteers did was to wear the portable Hairbeam 3 sensor around their neck, up to about, with a lanyard attached, up to about 2 meters or so around their breathing zones, so that we can capture essentially what particulate matter is in their breathing zone region. And this was what we did between the 1st of October and 29th of October 2024. While we set up, so we had 7 sensors in all, 3 was deployed for mobile monitoring, and simultaneously we had the remaining 4 stationed across the prevalent wind direction around the facility. We triangulated it around the facility to capture upwind and then the downwind concentration of the particulate matter. And lastly, we decided to, because we had the sensor, so we decided to extend the monitoring period from October 2024 up till around May 2025. So we had 7 months of prolonged stationary monitoring. That is off our agreed methodology. Please, next slide. Now, I present the results. These are excerpts, examples of the mobile monitoring data. The mobile monitoring data were captured in seconds. So for a period of about 15 seconds, we just presented what the time series is, and we can see values instantaneous values as high as 500, as high as 300, as high as 250. This is just a time series example of the mobile monitoring data for very short time, sometimes up to between 10 and 15 minutes. Next slide, please. To give context and empirism to the time series plot, we picked across the mobile monitoring sessions, we picked the short time peak PM2.5 from all the monitors. This is instantaneous, every 1 second, the largest value across the 3 monitoring, so that we can see what instantaneous values are, even though there is no comparison with WHO, any WHO guideline, because those require longer period of measurement, but just to see what the short-term exposure values are. We see values of up to 571 PM2.5. People get exposed to this kind of values, especially when the facility is operational. For about 30 minutes, this value is maintained. You see values between 300 and 500 for about 30 minutes, sustained period. And then they stop operating for another 30 minutes, 1 hour, and then value goes to like 10 or 13 or 14. And then they pick up operation again, and value goes as high as that. And they can do this periodic facility operation for up to 5-6 times in a day, sometimes more than that. So you are going to see 15 to 20 or 30 minutes of active operation of the facility, and instantaneous values per second as high, sometimes as 600 micrograms per meter cube. Even though these short-term values, the impact of the short-term values have not been studied, I felt like we should highlight it and talk about it. Next slide, please. Now, what I did here also, what we agreed to do here was to also take 1 hour PM2.5 levels across the various monitors for selected number of days. For all the days of measurements, of the period, across the period of measurement, we averaged every 1 hour. And so that's why I was explaining the instantaneous values. If I have 571 for about 15 minutes, and I have 10 for the next 20 minutes, or 5 for the next 20, by the time you average it out over 1 hour, the values come down substantially. But in my thought, that is not truly representative of the short-term exposure level of people. So it's good to highlight what the instantaneous values are, and also to highlight what the 1 hour averages are. And based on short-term values of, we had that code, I forgot it, ATSDR. There was a reference for short-term values, where we can compare. This is a significant result. All these values are quite high. Can we go on to the next slide? So this is where there are standards, and we can make comparison with the air quality guideline for daily averages. And so after I computed the instantaneous, we computed the 1 hour maximum, then we computed the average values, and across the average values for all of the monitors, we selected the 99th percentile, which is representative of the highest mean for the day, the highest average for each day. And according to WHO guideline, 24-hour 99% of PM2.5 shouldn't exceed 15 micrograms per meter cube. In Nigeria, there's a regulatory agency that is called NESRIA, and NESRIA set their value, I think, for technical feasibility as it were, because there was no rigorous research that went into that. And the value is 40 micrograms per meter cube as standard, for these emission levels. And so these daily averages are presented, and from the daily averages, we can see that all the mobile monitors exceeded the daily 99th percentile of the WHO air quality guideline. All of them. If we reference the Nigerian standard of 40 micrograms per meter cube, about 90% of the values exceeded the 40 micrograms per meter cube benchmark, which is something very, very worrisome. And so this is where scientific conversation now comes, because now we have WHO air quality guideline to benchmark our values against all of the days of measurement, just 25 days of measurement, all the values exceeded 15 micrograms per meter cube stipulated by WHO. And in one of the discussions, these values must not be more than, these values must not be exceeded more than 4 times or 4 days in a year. 4 days in a year. These values must not be exceeded for air quality to be good. For a good air quality, these values must not be exceeded for more than 15 micrograms sometimes must not be exceeded for more than 4 times in a year. And we only took 25 days of measurement, and all of the days of measurement exceeded the WHO air quality guideline. This is very, very disturbing. Can we go to the next slide? Similar story for the individual monitoring of PM10. The 83% of the mobile monitors also exceed the 99% WHO air quality guideline, which is 45 microgram per meter cube for PM10. Nigeria, again, has for technical feasibility, as it were, they raised the value from 150 to, from 45 of WHO to 150. And we kept asking questions as to how they arrive at this value. But for us, it's okay. If we pick that, then the value, we say for PM10 standard in Nigeria, maybe the value is a bit reasonable, a bit good. But PM2.5, we are in serious trouble. The next slide, please. Now, so these results are now summarized from across the 3 monitors that we have shown. 22 days exceeded for PM2.5. 22 days exceeded the WHO guideline, and that's 96% of number of days exceeded. For the sensor 5834, 22 days were also exceeded. That's 96%, and then for the sensor 3FO, 21 days were exceeded. That's about 91% exceedances of the WHO guideline. The values also for PM10 were presented. Most of the values for about 50% of the monitoring times exceeded the WHO guideline. The next slide, please. And so this is just a chart to show how many times these values exceeded the WHO standard, up to 7 to 8 times sometimes for PM2.5, and about 5 to 4 times most of the time for PM10. Next slide, please. And so then the next thing is to compute the AQI, the air quality index, based on the 99th percentile of the PM2.5 values that were measured. If the indicators are green, then if the values fall between 0 to 50, then it means the air quality is satisfactory and there is no risk. And these color indicators show what values are. If the values are between 51 to 100, then it is moderate. 101 to 150, orange, and then 151 to 200 is unhealthy, hazardous. And let's go to the next slide to see what this value comes to in Nigeria. Sorry, this slide didn't show the coloring. Sorry, I did that. So sorry. So these values were supposed to be colored, which I did. I'm sorry how I messed that up. Most of the values fall between unhealthy and that which is risky. Only I think 1 or 2 days were good, were moderate, were green. The other values fall substantially within the unhealthy AQI region. Sorry for the mix-up here. I'm going to rework this. Next slide, please. And then the stationarity analysis that we did, just to be able to attribute the contribution of the facility, as a significant source of pollution in that location. because in Onodjohwo, that, like I said, there are several, I call it a heterogeneous pollution source. There are several facilities polluting the atmosphere in very close proximity to one another. Around the targeted facility, that this our tire burning facility, adjacent it is a steel recycling facility. About 200 meters away from it is another aluminum maggot recycling facility. About 300 meters away from it is another facility. So all of them are releasing. But also, it's been difficult to attribute strongly and be able to say strongly this facility is the sole contributor to the pollution observed in Onodjohwo. And this stationarity analysis, following all the criteria that we said, think demonstrated the fact that we will not be able to say categorically that this singular facility is the sole contributor. And so our narrative is to say it is a major contributor, is also contributing to the pollution that is observed in Onodjohwo as we look at these values that are presented in the stationarity analysis. Can we go on? I'll almost be fast here. Now, one of the last things we did according to the methodological guideline was to set up stationary measurement in a distant place, away from Onodjohwo where there is active pollution. So we went to a pristine, let's say a pristine environment, because it was not truly very pristine, as there are other pollution sources, generator, most of them put on generator once it is evening and early mornings. And so that would somehow affect our reading of what a pristine condition is. But we filter some of those data out, and the blue line you see represents a more pristine environment, and while the red lines are places where there is active pollution. And these two values were taken concurrently, about the same day, the same time, and then we're able to compare them to see what the environment will look like in a more pristine environment. Next slide, please. So this is just a part of ours. Okay, 2 more minutes, I'll be through. This is just an extended measurement that we did. We took the stationary measurement for another 7 months, and this time series showed the elevated level of PM2.5. This is hourly value for 7 months across each of the months, and this time series is quite disturbing. Values as high as 100, between 100 and 400 sometimes. Next slide, please. Now, here we aggregated the hourly averages, all the hour zeros across the 7 months, that's 12 midnight, all the 1 a.m. across the 7 months, all the data in 2 a.m. across the 7 months. These were the values, and this indicated that nocturnal pollution was also going on. These facilities operate substantially at night, and these are some of the values we observed, far greater than the WHO standard across all of the hours of measurement. The lowest measurement was between 35 and 39, which occur between 11 a.m. and 3 p.m. And then there are peak activities sometimes, that are shown. Next slide, please. We created a table for the monthly mean concentration and variability, and we saw the PM values for 31st of October ranging between 46.85 plus or minus 53. These values show very high variability as the dispersions are high. You can have substantially high values at some point, and then very, very low values at other points when the facilities are not operational. Next slide, please. Conclusions. PM2.5 and 10 in Onodjohwo constantly exceeded WHO guidelines, posing ongoing public health risk. Mobile monitoring revealed frequent extreme short-term spikes with 99 percentile values exceeding thresholds on most days. Stationary monitoring showed sustained high PM2.5, especially during colder months, with notably daily fluctuations. Industrial activities such as waste burning contribute significantly to local pollution, though weather conditions also play a critical role. Air quality index analysis confirmed hazardous conditions across most of the monitoring period, highlighting the need for urgent mitigation and continuous monitoring. Lastly, the last slide. The limitation of our study. We highlighted the limitation, the short measurement period, the limited source attribution we tried to do. We had restricted access to industrial operation. They didn't allow us into their facility. And also, we are not able to estimate the health implication of this data, as we couldn't carry out the epidemiological assessment as we really wanted to. And then there is a very limited scientific basis to compare, national, the value we got across a national scale. There are recommendations. That should be my last slide. Yes. These are the recommendations that we propose. I hope my 2 minutes is already up.
Thank you. Thank you so much, Dr. Oladimeji. Thank you very much. That was an insightful presentation. If you have any comments for our speaker, Dr. Oladimeji, kindly add them in the chat and we'll get back to them when we have, there's an allocated time for a Q&A session. Something that caught my attention was, I said, in a whole month, there were just 2 days that were seemingly good in terms of air quality. Air quality is the fundamental human right of everyone in our environment. So that's astounding. Yeah. On to our next speakers. Our next speakers are presenting the Asia Pacific findings in the report. And this will be led by Dr. Jorge. Like I said earlier when we started, we did a research in 3 different countries in Nigeria, Philippines, and Indonesia. So Dr. Jorge and Al will be presenting on findings from the Asian Pacific. Dr. Jorge Emmanuel is an adjunct professor of environmental science and engineering at Silliman University. From 2003 to 2015, he was chief technical advisor for the Global Environmental Facility project of the United Nations Development Project in New York. Dr. Emmanuel leads the technical advisory team for air quality monitoring in Dumagati and Surabaya. In addition to Dr. Jorge, Al Tubongbanua, Al is part of the technical advisory team for air quality monitoring in Dumagati and Surabaya. Welcome both, and you have the room for 10 minutes. Thank you very much. Can we get it? Okay. Happy to see you, Dr. Jorge.
Yes, thank you very much. I'll see if I can get my slides to go full screen. Okay, can everybody see that? Is it good? It's been a pleasure for me to be working with Dr. Oladimeji in Nigeria. And for the work we've done here, I'd like to mention, in addition to Al, we have another scientist, Michael Bisario from the Negros Oriental State University. Both of them are working with me. I'd like to begin by first telling you a little bit about the city where this work was done. It's a city of 130,000 people. It was established in 1620. And it's a beautiful place surrounded by beaches, very old trees, nearby mountains. So it was very disturbing to us when we found out a few years ago that the city decided to put in a waste incinerator. I won't go into the details of the machine, but it's designed supposedly as a pyrolysis gasification machine. No stack emission tests were ever conducted. It began operation in 2022, so it's been going for three years now. Operates for 9 hours a day and 5 days a week. The pictures you're seeing, the one at the bottom is a picture of the machine, and the video you see on the right side showing all the black smoke coming out from the stack. Those are pictures. These are a picture and a video taken by other people, because none of us have been allowed inside, similar to what's happened in Indonesia and in Nigeria. Those of us who are concerned about the environmental and health effects are not being allowed to see this, even though this is supposed to be a public facility. So we were very happy to receive these Airbeam 3 devices. And so what we did is we mobilized 17 volunteers from the three communities surrounding this incinerator. As they did in Nigeria, they wore the devices around their necks, and they monitored from 8 to 6 in the evening, roughly about 10 hours a day. And each of the volunteers did it for between 9 to 10 days each. And we monitored from October of last year to February of this year. An important thing too is that each monitor submitted a time activity log, which means that they noted whenever they were close to people smoking cigarettes or close to people burning their trash or even cooking, any of the other sources of particulate matter. So this allowed us to then analyze the particulate matter by eliminating those that were known from other known sources. So I'm just going to go quickly over the results. So out of 27 days of monitoring, we found that 23 days exceeded the WHO guidelines. As mentioned by Dr. Dimeji, the daily exposure should not exceed 15 micrograms per cubic meter. And as you can see, those in red are the days where it was exceeded. So we're talking about 23 days, far more than the 4 days that are allowed in the WHO guideline. In addition, also comparing just what each volunteer was breathing, we took the 99th percentile, and what we found is that 16 out of the 17 volunteers were breathing PM 2.5 levels. Here I'm only showing PM 2.5 to simplify the discussion, but the PM 2.5 levels were exceeded in the case of 16 of the 17 volunteers, and 11 of the 7 volunteers exceeded it for more than 4 days individually. So within the 9 or 10 days that we're measuring, they had already exceeded for more than 4 days. Doing the air quality index, similar to what Dr. Dimeji explained, this is what it was for Dumaguete City. We had 5 days where it was unhealthy for the whole public. Orange, where it was unhealthy for people who were sensitive, in other words, people who were already sick with cardiopulmonary diseases, and for the young and the very old, for example, and 13 days where it was unhealthy for those who were highly sensitive people. And so in our case, we only had 3 days that were considered good in terms of air quality, the air quality index. So in other words, 88% of the days that we monitored, the air was unhealthy for some portion of the population. So the recommendations we made from our study is that the pyrolysis incinerator needs to be shut down immediately to protect the health and well-being of the surrounding communities and of the waste workers inside. We need to monitor the health of the waste workers in the facility and the health of the residents, considering that we know what the health effects are for PM 2.5 and PM 10 that Dr. Dimeji had outlined, and that the city attend to the health needs of these people. And it's also very important for us to implement zero waste solutions in all the communities of this city. In that way, we don't need to be burning the waste. And of course, the city felt, some government officials felt that by burning, you make the waste disappear. And what we showed is, in fact, the waste did not disappear, that in fact, it produced pollutants, transferred the poison out into the air, and that many of those, such as PM 2.5, cannot be seen by the naked eye. So these are the recommendations from our report. Al is now going to present the case for Indonesia.
Good day. I am Al, and I will present the report on the air quality monitoring in Surabaya, Indonesia. So this is a little background of the study. This is from the Minowo Waste to Energy plant. This is a gasification technology process and processes up to 1,500 tons of waste per day. Its operating hours are from 7 a.m. to 6 p.m. based on monitoring by Walhi East Java. But the facility operators have not yet publicly disclosed the operating hours. This facility affects a population of around 11,684 residents of Sumbirijo Urban Village in Pakal District, where the plant is located. And the community is concerned on pollution, including black smoke, wastewater, and an unpleasant odor that is affecting the residents as near as 1,000 meters away from the facility. Moving on to the findings. The maximum daily average of PM2.5 concentration levels ranged from 20 to 113 micrograms per cubic meter for PM2.5 across 14 monitors. And in the 31 days of monitoring, all exceeded the WHO air quality guidelines of 15 micrograms per cubic meter. It is to note here that in the Surabaya's level, it is 8 times above the guideline. For the air quality index, during the 31 days of monitoring, it is noted that 7 days were unhealthy for all of the population. 7 days were unhealthy for sensitive groups of the population, and 17 days were unhealthy for highly sensitive individuals of the population. There was no considered good day among the 31 days of monitoring. The recommendations by Walhi East Java is first to permanently shut down the Binowo Waste to Energy plant, to conduct an independent and transparent environmental audit and emission test. Third is to examine and address the health impacts on surrounding residents. Four is to promote zero waste policies such as source separation, recycling, and composting. And five is to provide financial and technical support to affected communities. And that is a short discussion on the findings for Surabaya, Indonesia.
Thanks, Al. Thanks, Al, for that presentation, and Dr. Jorge. That was really helpful. Thank you so much. If you have any questions for our speakers, please add them to the chats and we'll respond as we progress. But immediately, right now, we're just going into the Q&A session. I'm not sure if anyone has a question for us. I only see one comment on the Q&A session. But I know that is being responded to. So, yeah. Do we have any questions, please? All right. While we wait for more questions, I would suggest that we move on with our presentation. And once again, please feel free to make your additions to the comments, and also you make use of the Q&A session. We would like to hear your feedbacks, and someone who made a comment in Spanish about clarity. I'm not so sure if the clarity is based on language or how maybe the presentation is quite technical. I'm not so sure. But this, just like a reminder to everyone, this is a research that has taken place in Nigeria, Indonesia, and Philippines, where we have measured the air quality of communities that are hosting waste treatment facilities, like waste to energy facilities, pyrolysis facilities, a tire recycling facility that is just in the midst of some heterogeneous sources of pollution as well. So I will just, moving on, we would like to proceed to our panel's discussion today, and we'll be discussing on the role of grassroots movements in citizen science advocacy efforts. This will be led by member organizations in Nigeria who were who carried out the research in Ogun State, Nigeria, and this is in Great Knowledge Foundation, specifically Mr. Collins and Ms. Favour. Mr. Collins is a communications coordinator for Great Knowledge Foundation, and Ms. Favour is a public health professional and program officer at the Great Knowledge Foundation. where she leads community-based environmental health initiatives. Thank you so much, Mr. Collins and Favour. You have the room for 10 minutes, please. Let's try to keep to time. Thank you.
All right. Thank you so much for having us in this all-important conversation. On behalf of Green Knowledge Foundation, we want to say we are so glad to be part of this conversation and to also share on our work that we've been doing in Onodjohwo. This project has not only given us the opportunity to use scientific data to drive advocacy, but it has also helped us to work closely with the residents in Onodjohwo who are the front line of this pollution. It is helping us to, this initiative is helping us to give a voice to the residents of Onodjohwo who are oftentimes not heard. These residents now have the opportunity to use data. They have tools, and also they have the confidence to speak up about their health and also their environment. We believe strongly at Green Knowledge that real change begins from the grassroots. And we are so glad that residents of Onodjohwo are beginning to inspire that change, and they are the active agent in this change. At this moment, I would like to hand over to my colleague, who will take us deeper into the conversation that we're going to have today. Thank you.
Good afternoon, everyone. It's afternoon in Nigeria. I will be handling the presentation on the role of the grassroots movements in citizen science advocacy. So we'll begin by defining some core concepts. So what is citizen science? Citizen science is essentially scientific work that is undertaken by members of the general public, often in collaboration with or under the direction of professional scientists and scientific institutions. So the aim of citizen science is to decentralize expertise and localize knowledge within the host communities. Grassroots movements are community-led initiatives that emerge organically in response to specific issues that affect people, and specifically in Onodjohwo concerning their environment. And grassroots movements are non-institutional, they are informal and often volunteer-driven, and they are usually fueled by urgency, survival, and the quest for justice. And lastly, citizen science advocacy. It is essentially using scientific data that is gathered by citizens in order to drive social, environmental, and political change. The grassroots are the engine behind citizen science advocacy. So why do grassroots movements matter in citizen science advocacy? The first reason is that change from below, change from the grassroots is more sustainable than change coming from above. So if you start the change and trigger the change from the grassroots, it's easier to sustain that change than it coming from above. And also, science needs stories. The people we are dealing with, the research we're doing effectively affects people. And these are real lives, these are real stories that needs to be shared, that needs to be told. Data is beyond numbers and involves people. So science needs people, and that's why we need the grassroots movements, and that's why they matter in citizen science advocacy. And citizen science advocacy goes beyond collecting data, goes beyond collecting information. It is primarily about reclaiming the voice of the people in the community, influencing policy, defending the rights of these communities, and reshaping the narratives, especially in the area of the environment, reshaping the narratives concerning the Onodjohwo community, concerning the air pollution in the Onodjohwo community that is fueled by real people, real experiences, and real testimonials. So we have 6 roles of the grassroots citizen science advocacy. The first one is the knowledge custodianship. The grassroots actors hold oral histories, they hold indigenous knowledge that is very important to us in our research, to us in our initiative, because they help to correct scientific blind spots. These people have information that have been passed on from generation to generation, culture, a lot of things that imbibed and influenced by their culture. And we need that in science. We need cultural context. We need raw data to have rich cultural insights. And so that's one of the roles of the grassroots in citizen science advocacy. Another role is community mobilizers. The members of the grassroots actors, help us in recruiting volunteers. They help us to build trust and legitimacy in the host communities. They also help us create structures for collective action, help to trigger other members of their community to be a part of the initiatives that we take to those communities, and we're trying to help those communities. And we found out that no one can mobilize a village or a community like the villagers or the community members themselves. They are usually more effective in mobilizing each other than when an external party comes into the community. And the women in Onodjohwo community are a very good example, because they were very key in mobilizing and recruiting other volunteers amongst their peers in Onodjohwo. Another role of the grassroots is data collection and validation. For our project in Onodjohwo, most of our volunteers had the wearable air monitors, and they helped us conduct the field monitoring, monitoring the air, getting the data, collecting the samples, also recording the real-time environmental changes in the environment, tracking the violations of these industries, the hazards that they were exposed to. And we found out that a lot of the data that we get from the grassroots happens to be more frequent, because it comes almost on a daily basis as they observe, they report, and it is more granular and honest than institutional surveys. Another role is that they help and act as whistleblowers and watchdogs. So they are in the community, they are indigenous, and so they're able to, like I said, in real time, blow whistles on environmental degradation, track illegal pollution, track illegal dumping, air pollution, and alert NGOs like Green Knowledge Foundation. Also alert media houses as well to what is going on in real time in their community. And then we also have advocacy engines. The advocacy engines, which are part of the grassroots movement, help us to use data in drafting petitions, help us in, when we do our community engagement, speaking at the town halls, lobbying for policy change, and also challenging environmental health policies that are by using community-generated data. And lastly, the grassroots movements help create a bridge between the scientists, the community, the NGOs, the locals, the government, and the grassroots voices. They ensure that the concerns concerning regarding their community gets to the right ears, the research outcomes circle back to the community, and that interventions are culturally relevant, because that's a very important thing. The interventions for every community has to be culturally relevant and accepted by the members of the community. So these grassroots actors help us in ensuring all of these things. And the aim of the grassroots movement, at the end of the day, what do we want? What is the future? We want a future of co-powered science, where science is not done on the people, where the people are not test objects or lab rats or a means to an end, but the people are a huge part of the work. The people are a huge part of the scientific process, and that science is done with the people and for the people, not on the people. The grassroots movements help to make citizen science inclusive, because we're including the community, including the community members, including the stakeholders in the community, making our citizen science actionable, grounded in justice, and it's capable of changing and transforming lives, not just policies. Because like I said, data is just numbers without the people. Data is just numbers without the story. So citizen science helps us to add the face, real-time experiences, real-life experiences to our scientific process. And I'll end with this. When the people become the scientists, the science becomes unstoppable. You cannot stop science that is run by the people, by the indigenous people of the community. So once again, when the people become the scientists, the science becomes unstoppable. Thank you very much, ladies and gentlemen. Good evening again.
Yeah, wow. Thanks, Favour, and thanks to the Green Knowledge Foundation team for that excellent presentation. I've started seeing some questions on the Q&A session. And Dr. Dimeji and Al and everyone, please just wait till we get to the Q&A session, but I'll just ask the GKF team a few questions, one or two questions, and we move on. To the GKF team, I would like to ask, what unique challenges and opportunities do grassroots organizations face in leveraging citizen science for policy advocacy and government bodies?
Okay. Do I go first? I go first.
Yeah,
okay.
Very quickly, please.
All right. And we have a few challenges, but I will hinge on just three. So one of the challenges that we have is data credibility issues, because government bodies often question methodology and rigor and the data validity of citizen science initiatives because they believe that they've not been collected by experts, because the citizen science initiatives is obviously run by the community members, the grassroots. And so sometimes when their data is collected, the question of data credibility always comes up. Another challenge is political pushback and co-option when the citizen science, citizen-generated data, and if it contradicts official or government narratives, sometimes that is followed by hostility, that is followed by threats, that is followed by efforts to suppress. So that is another challenge. And lastly, burnout. When people have been engaged in advocacy for a very long time and they keep having the cycles of things changing and reverting to the status quo after a while, sometimes they burn out, sometimes they lose steam, sometimes they get tired of the process, and that is another challenge in maintaining sustainability and the impact of our citizen science advocacy efforts.
Okay, just to add to what my colleague just said, despite the challenges that come up with this work that we do, there are also opportunities. And one of the opportunities that I see here is that our volunteers moved away from being victims and they became like an expert. In one of our engagement that we had, one of the ladies said, one of the traders, the market woman said that she didn't know that she can collect data before, but now with this work, she will also want to ensure that our children knows that they can monitor air quality. And again, there is nothing that anybody can say to these villagers, these residents, these local people that are in the front line of this serious air pollution, because this data that they've collected is their own evidence. They have it. And it also gives an opportunity for them to start a conversation with the authority or the government. So I just wanted to add to what my colleague just said, and that's an opportunity that we see that we can.
All right, thank you so much, GKF, to the GKF team, Mr. Collins and Ms. Favour. We are moving on to the next section of this webinar. But before we move on, I will just ask you, GKF team, but please in 30 seconds, if let's assume that the Minister of Environment of Nigeria is listening to this webinar, what would you tell the public sector or Nigeria, or what we need to do to improve air quality in Onodjohwo? Mr. Collins, you can go quickly, please.
Oh, okay. So if the Minister of Environment is here, I will tell the Minister of Environment that, hello, Minister, the people of Onodjohwo need to breathe clean air. They know that they are breathing polluted air, and they need to breathe clean air because clean air is their right, and they cannot be denied of what is their right. And you have the power to change this narrative. They know and they feel oppressed, and they are ready to take decisive action, but they are going about it the right way. So, dear Minister, help them to enjoy their rights. Thank you very much.
Thank you very much. So I hope our dear Minister hears, but then he will definitely hear because we're working with the Federal Ministry of Environment. On to our last speaker of the day, Mafoko Phomane from GroundWork, who will be presenting on air quality and governance. So Mafoko Phomane is the environmental health campaigner at GroundWork. Mafoko is a public health professional and a researcher with over 15 years of experience in public health and development sector in South Africa and Lesotho. Over to you, Mafoko. And thanks for joining us today.
Thank you, Wemi, and thank you for the invitation. I'm going to try and share my screen. Please let me know once you can see it.
We can see it.
Is it on presenter mode? Thank you. Great, fantastic. It's good. It's evening in Johannesburg. Thank you again for the invitation and amazing speakers that have come before me. Ours is a story related to environmental justice at GroundWork. GroundWork, we work across various campaigns, but particularly on air quality and air pollution. South Africa is highly reliant on coal as its primary source of energy generation. And so air pollution is rife due to Eskom, which is a parastatal energy producer. And this has led us to being quite energy intensive and carbon intensive. And as you can see, various activities form sources of air pollution from coal-fired power stations, from various industry activities, mining operations, as well as vehicles. Of course, there is waste burning and biomass burning as well. Because of the air pollution which is rife, the minister over the years has declared various provinces priority areas, and really priority areas highlight the uneven distribution of the impacts of air pollution. In front of you, you see a map of South Africa and the various priority areas that have been declared at different times. It's the Highveld. Most of our work is situated in the Highveld, and this is where there are 12 of 15 Eskom coal-fired power stations, and there is the Vaal Triangle airshed priority area, as well as the Waterberg-Bojanala priority area. And across South Africa, exposure to PM 2.5 is alarmingly high, and large portions of the population are breathing air that exceeds both the country's annual national ambient air quality standards of 20 micrograms per cubic meter, as well as the World Health Organization's guideline as well, which has been referred to quite extensively today. The health impacts of air pollution cannot be left behind when we are discussing issues of air quality and governance, as well as health. And so over the years, as civil society, we have commissioned research that provides evidence as to what the health impacts look like due to Eskom's coal-fired power stations. But a recent report by Greenpeace indicates that in 2023 alone, 42,000 South Africans lost their lives due to exposure to fine particulate pollution, and unfortunately including 1,300 children under the age of 5. And so when the health impacts have been mentioned due to air pollution, respiratory illnesses, bronchitis. You can see the figures in front of you. And so a lot of this data and evidence then supports us in how we as civil society design our interventions. And largely our interventions are obviously supported by legislation. We look to our constitution, which affords everybody a right to live in an environment that is not harmful to their health and well-being. We look to the WHO guidelines, which we know are not really legally binding, but it is our government's duty to fulfill its obligations. We've got various laws, the Air Quality Act, and the impetus is to monitor air quality and regulate polluting industries. And really what we're seeing is rife non-compliance. And this is why, the struggle continues. As far as air quality monitoring is concerned, air quality monitoring stations are also mostly dysfunctional. If you see some are not operational, some are not meeting data requirements. And this then suggests that enforcement of the Air Quality Act is not adequate. And this is a slide shown by our National Air Quality Officer on air quality monitoring stations, and this was in 2024. And so there is then a need for civil society to participate in air quality monitoring to fulfill this gap that we're seeing from the state. And I think community-led interventions as well as citizen science has been talked about by previous speakers. And so this is our partner in Lephalale in Limpopo, who piloted the airbeam training. And this is really largely rural communities that are getting to have a better understanding of what air quality monitoring is. And the idea is for them to then be able to understand the science of air quality, monitoring the data. And as it's been said by previous speakers, this then opens the door for communities to engage with regulators to have a better evidence base, but also showing what their lived experience is. It then allows them to participate in environmental governance as well as health governance, because we cannot leave the health system behind when engaging on issues of air quality and air pollution. One of the challenges has been, I think what's been mentioned is around government officials then questioning the validity of the data. Our interventions have not been ongoing for that long, and we're hoping to learn from others in strengthening our community-led air quality monitoring initiatives. And as mentioned, health is part of our campaigning. And so we engage in educating affected communities on the health impacts of air pollution, as mentioned, building capacity so that they can engage with regulators at various fora, platforms that have been designed to ensure that air quality management plans are implemented, as well as then linking that with what's happening within the health system through clinic committees. I think, realizing that efforts are dwindling of the state, we have engaged in strategic litigation to bring the state's attention to the communities that are impacted by air pollution. And so in previous years, 2019, a group of organizations, Bogani Environmental Movement, GroundWork, supported by the Center for Environmental Rights, took the state to court to demand their right to live in an environment that is not harmful to their health and well-being. And the Constitutional Court then declared that, the poor ambient air quality is a direct violation of the people's right. And so the courts then ordered the government to enforce regulations meant to bring the industry into compliance. So this is a case that's dubbed the Deadly Air case, and it really is a precedent-setting case that we continue to use to engage the state and regulators, and it's really opened doors for us to have a seat at the table in engaging on issues of air quality as well as health. One last case that we are quite excited about is the Cancel Coal case, which is our first sort of youth-led climate litigation, where the youth are challenged the state's plans to procure new coal-fired power. And the foundation of the case was around that new coal-fired power would be contributing to climate change, as well as air pollution, water pollution, health impacts, and very unnecessary socioeconomic harms. And the call was for the ending of new coal in South Africa. And the victory was based on the fact that the courts found that the government did not consult the youth when making this plan, but more importantly, was not considering the youth's future. And so it was declared that the inclusion of new coal-fired power is invalid and unlawful and would have negative impacts on children's rights. So these are some of the victories that we have been leveraging on, but we continue to want to learn from others around air quality monitoring and governance from civil society. The importance of citizen science has been already mentioned. I'll leave it here, Wemi. Thank you for the opportunity.
Thank you so much. Thank you so much, Mafoko. That was an inspiring story. Kudos to you and the GroundWorks team. Once again, if you have any questions for our speakers, kindly add them in the chat or the Q&A session, and we'll get back to them. And I want to thank Dr. Jorge, who has been responding to questions. But however, there's a question here I would like to call out Dr. Dimeji to respond to. The question is from Brex Arivalo. Have the findings in Onodjohwo been presented to the community and to other actors? How did they react to these findings? Dr. Dimeji, I remember 2 weeks ago you met with the community. Please go ahead. Briefly.
Thank you. Yes, thank you very much. We had the community engagement 2 weeks ago in Onodjohwo, where we met at the King's Palace, Yoruba's Palace. And it was a very engaging conversation, and we hope to sustain it because the community were very, very excited at the report, and they were very disturbed at the alarming level of particulate matter elevation that we presented. And they were pleading that we will not rest on ours, but continue to advocate for the cause of good air in Onodjohwo, and which we did promise. And so going forward, we would like to engage council leadership, engage state government officials, and the regulators, as it were.
Thank you very much, Dr. Hoy. And it was interesting because I was there live. Dr. Dimeji actually spoke in their local dialects where they really understood the findings. And I got a call from someone from the community about 2 days ago stating that they even intend to engage their local environmental ministry, and the Federal Ministry of Environment is also expecting our final policy reports and things like that. So I know that the community is excited and to take action. And this commission, also we know that a journalist also decided to take action and do a mini documentary of that community, where the Commissioner of Environment responded and said they are thinking of moving the companies to an industrial site where they can monitor all of them together rather than having industries and residents living together. So our prayer and our hope is that these things come to life very, very soon. Thank you very much, Dr. Dimeji and Dr. Jorge. And there's also another question here. I know it has been responded to, but I don't know if we still want to speak quickly about it, especially from the AP region. Cecilia Bianco says, thank you very much for the introductions. Have you filed a complaint with the courts? Which agency has a jurisdiction over air quality? In Nigeria, we know it's the Federal Ministry of Environment, then NESRA actually implements or enforces these laws, but I don't know what, if Dr. Jorge is able to respond just vocally before we move on in this webinar. Thank you.
Yes, since we started presenting this information to the community, we have gotten a number of people volunteering to bring together legal scholars and lawyers to strategize on legal remedies, perhaps bringing litigation to the courts using our existing laws. And during the discussion, a number of very good opportunities have been raised specifically for the Philippines. But in terms of the people in charge, it's actually the Department of Environment and Natural Resources that has jurisdiction over things like air quality, air emissions. The problem is that it's that very that same department that has recommended the use of this incinerator in Dumaguete City. So this is, to me, the irony. Even though we do have laws that prohibit incineration, that law is often ignored, and even the government itself has been pushing for some of these incinerator facilities. And note that in our case, it has never been tested, which again is contrary to what is in our regulations.
Right. Thank you so much, Dr. Jorge. Do we have any other additional comments for Dr. Jorge and for if anyone has any further question? However, I think we have come a long way so far. And in addition, for Nigeria, I know that when we're doing our desktop research, we realized that the community had initially sued the companies, but the lawsuits felt like they were supposed to pay damages, just a few naira, and the companies were willing to buy people's land. So the next question is, do you just want to move people out of their ancestral homes just because you intend to recycle, in quote, recycle tires, in quote, and produce black oil? But I think we have come a long way already. And once again, I want to thank the speakers for your very apt and insightful presentations. I want to thank everyone who has taken our time to be a part of this meeting. So we'll be sharing the reports with everyone who has registered. Like I said, we'll share via your emails, and please, you will also receive the recording of this meeting. And then once again, I want to thank the speakers and the organizers for your support, the GAIA team, the GAIA AP team, the GAIA Africa team, GAIA Global, and also for our technical advisors, Dr. Jorge, Dr. Dimeji, Al, and Green Knowledge Foundation, Wally, and WOW. And I will just say thank you everyone for your support. We have really covered a lot. We have listened to experts sharing findings from these 3 different countries. We have also shared CSOs working on community citizen science. We've also had Mafoko present to us advocacy efforts happening in South Africa and the GroundWorks Foundation in South Africa. So I want to once again say thank you to everybody, and this would say is the end of our wonderful webinar for today. And once again, remember that clean air is our fundamental human rights, and everyone